I don't exactly know how it worked that I'm the guy that got to present, but somehow Kent nominated me for that. So we'll work our way through this. I think what Eric had asked me to do was to do a couple of things. Ask Kent and I to put together a presentation that talked just a little bit at the beginning about who we are and what we do, because I think the original question was trying to get some feedback or some perspective from practicing veterinarians. And while we are practicing veterinarians in private practice, we're probably quite a bit different than maybe what the profile might be of mixed animal practitioners, and even maybe a little bit different than those who specialize on the consulting thing. So I'm going to take a few minutes just to give you some perspective of what we do and how we do it, to give you a little bit of background of where we come from. Then I'm going to try and talk about our approach to trying to understand the impact of feedlot antimicrobial use on antimicrobial resistance. We'll talk a little bit about some of the key findings that have been generated to date. We'll talk a little bit about our current initiatives, and then hopefully we can provide a little bit of summary there and go from that. If there's any questions along the way, I'll probably stop a couple times during the presentation and just see if anybody has any questions, and then I think as long as I don't go over time, we probably have some time for questions at the end if that works. So the next little series of slides will be a little bit about our company, just to give you a little bit of background perspective. Some of you in the room may be familiar with us, some not. But we call ourselves a professional services company that tries to provide a full suite of production consulting services and tools to commercial feedlots and calf grower operations. And we work in Canada and the United States and in Mexico with operations on a daily basis, and I'll explain a little bit more about what that means in a bit. And then we have a number of ongoing business development projects in other countries, probably most notably in South Africa, China, and Russia. We are a Canadian company, started in Western Canada back in 1983 when our founding partner, Keith Jim, graduated from veterinary school. We're based just out of Okotoks, which is just south of Calgary, and the operations that we work with put through about 2.5 million to 3 million beef cattle a year. We have a couple of partner companies. We're not going to talk too much about those today, but in both the cow-calf side of things and the dairy side of things, that provide analogous services to what we do on the feedlot health side in the beef cow-calf and the commercial dairy sectors. Again, we won't focus on that, but you can just be thinking about that in the back of your mind. Part of our mission as a company, we have a mission statement, and the first part talks about what we want to do, and I guess the last part is probably more important because it talks about our clients. The first part talks about all these things that we'd like to provide, which are, world-class consulting services and research services, and management and execution tools, and etc. But I think the most important part of that is we're trying to improve the net profitability of our feedlot and calf grower clients. And part of that includes helping them develop sustainable production systems. And relative to our discussion today about antimicrobial use and antimicrobial resistance, the sustainability part probably is an important component of that. This is just a Google map of North America, and those different colored pins on there represent commercial operations that subscribe to our services and that are we interact with on a daily basis, providing one or more service modules. We have our data collection and capture systems in place, and overnight, every night, those systems sync with our office to update the animal health and production data in our office so that our team of consultants, whether they're located in our office or outside of our office, can be sort of plugged into what's happening on those operations every day of the year. And that's what we strive to do. A little bit of the color coding there. The yellow pins are commercial feedlots. So you can see that's by far and away our main thing that we focus on. vast majority of those pins are in Western Canada because that's where we started, but they're obviously spread out into the cattle feeding areas of the United States as well as into Mexico. The green pins are actually these calf grower operations. Those are the guys that take the day-old dairy calves and raise them to about 300 or 325 pounds. And then if they're heifer calves, they go back into the dairy replacement heifer development side of things. And if they're bull calves, then they come to commercial feedlots and are fed all the way to harvest from there. And you can see that there's some of those in Canada, some in the U.S., and some in Mexico. The pink pins or the magenta pins or whatever color that looks like on your screen, those are stocker backgrounder operations that ultimately feed stocker or backgrounded feeder cattle into feedlots, both in Canada and the U.S., because one case the cattle actually go north into eastern Canada and are fed there. And in the other case, they obviously go to the high plains. And then the light blue pins are the commercial dairies with the dairy health management services, which we've just been up and working with for the last couple of years. So we get to see lots of different climatic conditions going from north to south, lots of different climatic conditions going from east to west, lots of different regulatory environments going from across 3 countries in multiple different states and jurisdictions. So gives us lots of different exposure to different ways of doing things. Maybe that's the right way to put that. We got relative business, several different things about our business approach, but relevant to today's discussion, there's probably 2 I'd like to highlight. One is that we have a big focus on data collection and analysis. And really that drives to the individual animal data level, including the antimicrobial use data. And in order to accomplish that, going way back to when we started in the early and mid-1980s, we realized we were going to have to computerize that. And good, bad, or indifferent, there really weren't any systems that were capable of recording that data back then, so we built our own. And we didn't really want to be in the software business, but we ended up in it because in order to have systems that could collect the data that we wanted to use as veterinarians and animal health consultants, we had to build our own to accomplish that. And that's really what allowed us to make decision-making models that were based on data collection and analysis, generating hypotheses based on the analysis. We'd set up large-scale field research programs to test some of those hypotheses and then ultimately put together the economic modeling. The second point that I'd like to make is that we've tried to continually modify or have our business model evolve to facilitate sustainability. And 2 parts to that. First, even though we were veterinarians and that's where we started, we realized fairly quickly that animal health management was just one small piece of the pie, so to speak, in terms of feedlot production and getting a feedlot animal out the other end of the feedlot. So we set about trying to understand as much as we could about the procurement, the production piece, which is the piece when they're in the feedlot, and the marketing of those animals, including the economic, environmental, and ethical sustainability of putting that together. And that probably really speaks, I guess, again, to this whole AMR and AM thing. How does that fit together in the discussion? And then last but not least, realizing that, to just show up from time to time and make recommendations probably wasn't going to be particularly, wasn't going to be as useful as it could be either, or for the commercial operations. And so we tried to figure out ways that we could be plugged in daily to understand what was happening. We have a fairly big team. There's 26 of us that are either veterinarians or PhD nutritionists and animal scientists. A couple of them, I guess, are engineers. We've got a large support team. And that team that I get to work with in our office has a lot of different areas of expertise and knowledge and background. I put a picture of them up there because Kent and I might be the guys that get to be out and about and talk to people like yourselves today. It's this team of individuals behind the scenes that helps lead those services provided to the commercial feedlots as well as to the research and development efforts. that we have ongoing. So pretty broad group of team of folks, and if you're trying to put a face to Kent and we're both in the top row. I'm second from the left at the top, and Kent is fifth from the left. Sometimes people wonder, how does research fit into what we do? Because we do a lot of research and development, and I've just flashed a slide up that has lots of boxes and lots of arrows and heads on those arrows go in multiple different directions, and I'm not going to take you through all of this or try to. But if you look over on the right side of the screen, there's a box that says Production Consulting Services for Feedlots and Calf Growers. That's our primary business of what we do as a company. And those abbreviations that are in that box with the stars beside them, AH is animal health, FF is feeds and feeding, there's a variety of others. Those are service modules that clients, commercial operations, can subscribe to our company, or from our company. And when we bring those to a commercial operation, we bring a lot of data collection and monitoring systems with that, which is what's represented in the box kind of in the middle that has the blue dashes around it. It says FH, IFHMS, digital imaging, and a variety of stuff. That really allows us to be plugged in and try and understand and monitor what's happening in those operations day to day. As we analyze that data, then if you keep going to the left, that leads us into a number of ongoing research and development projects. And so we ended up setting up research and development infrastructure because we had all these, I'm not sure we had all of these, but there were a lot of ideas that came out of the data analysis side, and we needed to test those ideas. Some of those had been looked at by other researchers, but many hadn't, and so we ended up developing a research infrastructure so it would connect us on the bottom left of the diagram and let us get back to the production consulting side. So, bit of a confusing diagram, probably beyond the scope of today's discussion to go into it in more detail, but really the ongoing research and development is what helps drive new knowledge for the production consulting side of things. Because we're interacting with our clients on a daily basis, really they expect us, and by the way, they're paying us for that, they expect us to create them value on an ongoing basis. And the two big ways that we do that is, one, this whole continuous research and development side of things, as I alluded to in that previous slide. And then the second part is this daily oversight, monitoring, consultation, input that we can provide by looking at the data and using that as a method of flagging things that are offline, or use it as a method of flagging compliance issues, etc. So that's where we're coming from. We're serious about the animal care side of things, partially because we do a lot of research, partially because we're veterinarians, partially as an industry as a whole. We need to understand how we're going to manage animal care going forward as part of the sustainability component. And so we do have our own animal care committee. We are certified by the Canadian Council of Animal Care, and that flows into this antimicrobial use and resistance discussion, because, you know, if you go way out there on one end of the spectrum and suggest that we maybe shouldn't be allowed to use antimicrobials at all in animal agriculture, that's obviously going to have some impacts on the animal care side. And again, it's all about balance and trying to figure out how we balance all of those different priorities. This slide just looks specifically at the animal health side of things, and I think I've touched on all of these points that give you enough perspective as to where we're coming from. Probably if you read the black highlight there, where it talks about the data-driven approach, the daily real-time monitoring 365 days a year, and an analysis and summary, that I think you get a flavor of where we're coming from in that we're really the data folks, trying to make decisions based on data as opposed to just relying on clinical experience and observation. And last but not least, you know, I've put up this diagram of the evidence-based approach, which is not a diagram that we came up with. It was a diagram published in JAVMA back in 2009. And we've adapted a couple of things to it, but we really are focused on trying to think about the quality of the information that we use to make decisions and recommendations, both in clinical practice as well as when asked to make input to groups relative to policy and regulation development, et cetera, and are trying to focus on, pieces of information that are high quality evidence that we have a lot of confidence in, as opposed to things that are lower in on that pyramid, clinical experience, ideas and editorials, first principles and bench research. So I think it's really important to give you guys some perspective on where that comes from. Okay, enough of the background. A little bit about our approach to trying to understand the impact of feedlot antimicrobial use on antimicrobial resistance. And you'll see AMU and AMR quite a few times, so that's the definition of those. I guess when we sat back and looked at this, and this goes back a ways, as you're going to see, it was in the mid to late 1990s when the sort of topic of antimicrobial resistance really started to hit the top of the ideas or concerns for animal agriculture, mostly driven by changes that were happening in Europe relative to antimicrobial use policies. But we sat back and realized that there were probably some things we knew or that we agreed on. One was that the management of antimicrobial resistance is important for both animal and human health. I think to think that we can actually eliminate antimicrobial resistance is not an attainable goal. Figuring out how to manage it probably is what's important, and it's important for both animal and human health. The second thing that we started from is that we realized that there was an overlap of the ecological systems shared by humans and animals. And further to that, I don't think we knew how much or how little overlap there was. I don't know if we realized it at the time, but we very, very soon got our mind around the fact that antimicrobial resistance is a very complex issue, and there are no simple solutions. And while there are some advocates for particular policies and regulations that would suggest if we make some very simple changes on how we're allowed to use antimicrobials, that will make the whole antimicrobial resistance issue go away. And anybody who's studied it realizes that it's not going to make it go away, and in fact some of those changes actually might not even have any impacts. And last but not least, I think it's important to realize or to state outright that antimicrobials are an important tool for managing animal and human health. And they're going to remain important tools, and our goal is to figure out how can we develop sustainable methods for doing that. And you guys are probably all up to speed on all those. So, of course, our challenge is there are very complex ecosystem linkages that I don't even think today we understand how complex they are. And at least so far, it's been hard to find meaningful and practical ways to significantly reduce antimicrobial resistance. We got some real cool tools coming down the pipe with the metagenomics and some of that kind of stuff. And I guess if you're an optimist, you would think that that's really going to let us understand these ecosystem linkages better. If you're a bit more pragmatic, you might just show us how much more complicated it is than we ever thought it was. So maybe ignorance has been bliss. Continuing on then with a little bit with our approach, we said, I guess we don't know any more about this topic than anybody else, but probably it's going to be important to establish some baseline levels and trends so we know where we're at. Hopefully that will allow us to identify some knowledge gaps so we can figure out where future research, what types of future research should occur. We were hopeful even back then that whatever the results of the current and future research would be, that those would be applied to shape policy, regulations, and education going forward, and that would be a research-driven function, as a research findings-driven function, as opposed to a popular press type of approach or a precautionary principle type of approach. And last but not least, we wanted to make progress over time, realizing that this looked like a really big issue, and that it was unlikely that the status quo was going to be the right answer, and it was unlikely that we weren't going to learn new things tomorrow that would shape what we do tomorrow. The other thing we realized is that as an individual veterinary practice, we probably weren't going to get very far on our own in this process, and that we were going to need to collaborate with multidisciplinary groups to get the process started, because we were just feedlot veterinarians. We could collect samples, we had lots of data, but really to work with the groups of individuals that would be able to help understand and do the laboratory work and do a lot of the key things that were going to make this work, we're going to have to work with others, and it was probably going to have to be a very structured process. And then we also realized that we were going to need to solicit industry participation and support, meaning the cattle industry themselves. And at least in Canada and in Western Canada, we were able to convince the cattle industry that this was, back in the mid to late 1990s, that this was an important issue that they should try and get ahead of, as opposed to trying to react, reactively in the process. So we were able to be part of, so far, 3 pretty big projects that have helped us have a better understanding of what is or isn't going on. A baseline study in 1998 and 1999, a follow-up study in 2007 to 2010 that allowed us to generate more baseline data and explore more knowledge gaps, and a current project which is a 5-year project to hopefully let us keep filling in some of those gaps. I think that, I put the next slide up, and I've tried to highlight and bold the groups that are involved, because the people that are listed there are really just the lead contact for each of those agencies or institutions. And while this is Canadian work, I think it speaks to the fact that we've tried to bring in expertise from lots of different areas, whether those are veterinarians, whether those are scientists and microbiologists like Dr. McAllister's group at Agriculture and Agri-Food Canada. We've got epidemiologists involved as we're trying to understand what some of those ecosystem things look like, and we pull the data together. We've got human medical team at the University of Calgary involved, and lots of other folks as well, as we and this is the core group. There's also people related to the latest project in the soils labs and the water labs, et cetera, to try and understand what's happening from the environmental perspective. So it's a big group. I'm not going to be able to acknowledge everybody, but I think the point is we're just one very small player in this group. The other part is that this takes money to do, and to try and do it without having money is difficult, if not impossible. And you can see there's been lots of support for trying to understand this issue, and some of that has come from the federal government and the Alberta government. So the Advancing Canadian Agriculture and Agri-Food Program was a federal government funding initiative. The Alberta Livestock and Meat Agency is obviously provincial. But it's also been funded by industry. Alberta Beef Producers is exactly what it sounds like, and that's checkoff dollars here in the province of Alberta. Beef Cattle Research Council, Canadian Cattlemen's Association, that's federal checkoff dollars. So those are directly trying to put together funding resources to allow these types of projects to happen so that we could try and learn more about where we're at and maybe where we're going. So some key findings to date. If we start with the first study in 1998, 1999, we worked with 4 commercial feedlots and randomly selected pens and animals and enrolled 2,622 individual animals from a population of about, I'd have to think about that, but I think the population was about 50,000 animals. Sampled at arrival, rehandling, and exit, so sampled 3 times. We also included voluntary sampling, I might add, from 61 feedlot workers as being part of the same project. And there were rectal swabs and nasal swabs taken at each of those 3 time periods. The focus on the rectal swabs was on VREs, or vancomycin-resistant enterococci, Campylobacter species, Salmonella species, and E. coli, because those were pathogens of human concern, human health concern. On the nasal swab side of things, obviously, methicillin-resistant Staph aureus from a human health perspective, and then we were interested in trying to learn something about veterinary pathogens as well, hence we have the respiratory disease pathogens included in there as well. In spite of using what at the time were the best, I guess, methodologic tools that were available in the laboratory and the isolation side of things, we didn't identify any vancomycin-resistant enterococci and no methicillin-resistant Staph aureus from cattle or workers at that time. So that was a good news story. No one knew what we were going to find. We didn't have any idea. Lots of people had hypothesized that we'd find lots of those types of organisms, and I guess we were somewhat relieved that we didn't. There were no Salmonella species recovered from resistant or non-resistant from cattle or workers. Methodologically wise, we were using rectal swabs, which is not the best method to do that. But we didn't really expect to find much Salmonella because we just don't see it very much in Western Canada, and that's probably because of our climatic conditions as much as anything. But we didn't recover it here in this study, and you're going to see that's fairly consistent in the subsequent work. There were negligible levels of resistance to fluoroquinolones, gentamicin, and meropenem, which is a cephalosporin in Campylobacter species that were there, and there was no ciprofloxacin-resistant E. coli identified in cattle or people. So again, there were before this study was done at that time in the mid to late 90s, there were lots of concerns about what we might find. Those was the good news stuff. If we look at the next slide, though, there were some things that at least made us think, we better look more and see what's happening. So resistance to ampicillin was detected commonly in E. coli from cattle, and a subset of those isolates exhibited resistance, ESBL type resistance, or to the extended spectrum cephalosporins. And as we looked at the link with the Feedlot antimicrobial use data, that looked like it was probably somewhat linked, or there was an association with tetracycline exposure, both in feed and or parenterally. The good news, I guess, was there was no evidence of transmission of the CMYA2 or other ampicillin AMP-C strains to the human workers. So while it was there in the cattle samples, and there might be a linkage to some of our antimicrobial use side, didn't really look like it was showing up in our human workers that had volunteered for the study. On the other good side of that, I guess, is for the bovine respiratory pathogen side, which may not have a lot of human health implications. There were very low levels of resistance to tetracyclines and macrolides, in spite of the fact that these products were used as part of disease prevention and control programs in many of the high-risk animals in this study. So that was that provided us some baseline data in 98 and 99 on a fairly large randomly selected population from within a bigger population of incoming cattle into feedlots. So at least we knew where we started. And by the time 10 years had passed, we realized that we probably needed to continue to understand what was happening, and there were probably some other things that it might need to explore and be concerned about. So we were able to put together funding, I say we, again, small part of this bigger group, that we conducted in the live animal phase from 2007 through 2010. Two-stage random sampling, again in 4 feedlots, 30% of pens, 10% of individual animals in those pens, and that bigger population over that time frame was about 180,000 animals over 1,000 pens that we then selected 30% of the pens and 10% of the animals in those pens. And we explored lots of different things. As a research group, we were trying to understand whether individual samples were more important than group samples. Obviously, group sampling of composite fecal samples is much easier to do than trying to collect individual animal samples. And we were trying to explore which one of those gave us more information. We included Mannheimia again to try and get try and understand what was happening on the veterinary pathogen side as well as on the bacteria or pathogens of human concern. And we did animals both when they arrived at the feedlot and then at least 60 days later, so that we could try and understand what changes might be occurring throughout the feeding period. Generated a lot of samples, as you could imagine, far more than the lab could process. We had 5,500 animals enrolled on the study. Sampling them twice, you got 11,000 samples. They developed some PCR technology for the Mannheimia hemolytica, and so we were matching animals that were both positive for Mannheimia and then getting non-type specific E. coli from them. But on that slide that you're looking at, if you get near the bottom, you can see we have 4,500 isolates of Mannheimia and 5,500 isolates of E. coli that were then available to us for susceptibility testing. So again, large project, lots of samples to try and give us a really good broad cross-section look at the types of resistance elements we might see, and let us explore AMU and some other things. We looked at a couple different methods of susceptibility testing. Most of the stuff that's reported in the literature had historically been done with the sensititer plates, because that's what's used in human medicine. There's some advantages to that. Of course, some of the disadvantages are that there's many antimicrobials of veterinary importance that aren't included on those sensititer plates. And so the laboratory team also used the biomic tools so that we could look at some of the veterinary pathogens or veterinary antimicrobials, and I'm going to show you some of that as well. And then there was a lot of work done on the molecular side of things, which is really where I get out of my area of expertise in a hurry. Looking at some of these determinants and looking at the integrons and the resistance genes, and especially focused on these ESBLs because of their importance to human medicine and trying to understand what's going on there. I can't pretend to be able to get the information to you from all of these different aspects of these studies, but I've cherry-picked a couple of things that might be interesting to the group about what we've learned. So this figure here is the prevalence of antimicrobial resistance in the E. coli isolates from the composite samples. If you remember, we actually took individual animal samples as well. The graph looks the same, so I thought we'd spare the repetition. And disc diffusion on the left is the biomic testing, and broth microdilution is on the right, which is the sensititer plates. And then you got both tests, because there's some antimicrobials that were done with both tests in the middle. You can see there's a lot of isolates there that were tested. I think a couple things that shouldn't be too surprising if you've looked at much of this type of resistance data coming from feedlots, that the three antimicrobials that show up the most are streptomycin, sulfa drugs of one sort or another, and tetracyclines. Okay, so that's, I think, the first thing that pops out at that. The second thing, I guess, is there's a few others that show up. Chlorphenicol shows up a little bit. Ampicillin shows up a little bit. Chloramphenicol over on the right, even though it hasn't been used in decades, shows up, but maybe that's cross-selected from the chloramphenicol side of things. And then there's really not a lot of other stuff that shows there. Second thing is, if you look at the color coding of those bars, red samples are the arrival samples, yellow samples are less than 75 days on feed. You guys can read the scale. I don't need to read it to you. If you look across the chloramphenicol, ampicillin, streptomycin, sulfasoxyl, and chloramphenicol, really it increases a little bit, but it looks as we get further out it decreases. Tetracyclines is really the only one that continues to increase throughout the feeding period. So I guess we should make a note of that. It starts at 60%, and as we get a lot more exposure later in the feeding period, we're up to 80. One of the things to probably it's an important thing to know is that, at least in these Canadian feedlots, chlorotetracycline would be used for liver abscess control in the vast majority of these animals. So that'd be a little bit different than the U.S. scenario, where tylosin would probably take that spot. I don't think anything else that's too dramatic over time. If I go to the next slide, now this looks at the prevalence of resistance in the Mannheimia isolates. We had a lot of Mannheimia isolates, if you remember from that schematic that I had on in a previous slide where we had 4,500 isolates, randomly selected from, obviously those are coming from healthy cattle at the time that they're sampled. And I guess what's interesting to me is in healthy cattle, the Mannheimia isolates don't have much resistance. That's my take-home message from this slide. And the resistance that was detected is to things like spectinomycin, kanamycin, and danafloxacin, none of which are hardly used very much in feedlot production. So, you know, and I try and figure out how does this relate to what we see at diagnostic lab submissions, where obviously we see a dramatically different profile of resistance, but those are not actually from clinically normal animals for the most part. In fact, they might not even just be from clinically sick animals. They're usually from those that didn't recover or potentially those that died. So not sure which is the right one to necessarily look at, but I think what it highlights to me is we probably need to make sure we have a broad perspective of the different profiles of antimicrobial resistance as opposed to only focusing on one pool or another of samples. What about linkages with antimicrobial use? One of the things that we bring as part of one of the members of the research team is we have all of this individual animal antimicrobial use data documented at a fairly detailed level that allowed us to go with this. So if we look specifically in this study, you know, of all of those animals and samplings, we recovered Mannheimia about 15% of the time from these clinically healthy animals. And about half of those animals, 47.5, had received parenteral antimicrobials during the study period. Usually that was at initial arrival processing. And of that exposure, of that 47, 21% and 23% were tetracyclines and macrolides, which shouldn't surprise any of us too much. So 44% of the 47% is those two. And then when you look then at the other types of antimicrobials that we would potentially use therapeutically in feedlot production, the beta-lactams, the quinolones, the phenocols, and the sulfonamides, they were given to less than 2% of the study cattle. So while those other antimicrobials are licensed for use in food-producing animals, really there's not a lot of them used as evidenced by this study. What about parenteral antimicrobial exposure? How did it affect our results? Well, I don't think there's anything that's going to be too earth-shattering here. One is that at the individual animal level, if you were an individual animal that had received parenteral antimicrobial exposure, we were less likely to recover Mannheimia from you as an individual. And since most of these antimicrobials are designed to actually to actually help the body fight off Mannheimia infections, would seem to me that actually makes sense. Interestingly enough, though, if your pen mates received parenteral antimicrobial exposure, then you were more likely that we would, or it was more likely that we would recover Mannheimia from an individual animal in that pen. That probably makes sense because the pens that would receive the higher exposure would be the higher risk animals, which in theory would have a greater occurrence of Mannheimia circulating in the population, or certainly present and replicating at a higher level than it might be in low risk animals. What's interesting to me is that in spite of all the antimicrobial use data that we had, antimicrobial exposures were not associated with resistance to any single drug. So we couldn't find any of those. We used this drug and it was associated with this resistance pattern. So that, you know, kind of flies in the face a little bit, I think, of what our bias might be, what my bias might be, that when we use antimicrobials that's going to select for certain resistance to show up in the population in healthy animals. We didn't find that, but there are some things that I guess we should be concerned of. And while it didn't occur very often, and while we did not detect multi-drug resistance Mannheimia hemolytica very often, when we did detect it, it was associated in recovering it from animals in which their pen mates had received antimicrobial exposures. So no specific ones, but the more antimicrobial exposure there was at the pen level, the more likely we were to recover multi-drug resistance mannheimia, even though we didn't recover it very often. And you can see the odds ratio is huge there. It's like 24. The confidence interval is a mile wide, 8.4 to 68. Nonetheless, all of those are big numbers. So that probably does dovetail a bit with what some of the findings in the diagnostic labs have told us relative to things like multi-drug resistant mannheimia. What other stuff did we find in those in that study? Well, there was virtually no salmonella recovered again during the study, in spite of much enhanced methods using fecal samples instead of rectal swabs. Having several groups from the U.S., including Guy Lonergan's group, come in and try and look at what was happening in the lab to make sure we didn't have some. We just virtually can't find it in this part of the world. That's a good thing. I'm not sure that's related to our anything other than the fact that our climate is what's driving that. So we don't get to take credit, I don't think, for our great antimicrobial use policies. There was none of these extended spectrum beta lactamase producing E. coli detected in the isolates, and so that's a good news story. And I guess resistance to antimicrobial drugs classified as very important to human medicine by the Veterinary Drugs Directorate in Health Canada, which would be similar to FDA, CVM, FDA in the U.S., were either absent or rare in both the E. coli and the Mannheimia hemolytica isolates in this study. So that, if we're going to talk about classes of antimicrobial resistance, that's probably important. There's lots of other stuff that came out of this study. I can't pretend to tell you all of it, but there's a lot of things that allow us to do more work over time on that. And unless somebody has some questions about those, I think we'll just skip that and move on and just talk quickly about current initiatives. So then if we look at current initiatives, as we met as a group meaning the research group looking at this antimicrobial resistance things, there were a couple of things that looked like they were still important subjects or important things to follow up on. And so the current project that we're working on has a long title, but surveillance of E. coli, enterococci, antimicrobial resistance, and trying to look in the environment and see what's happening in the environment, because we really haven't focused there too much in the previous studies. And again, a big chunk of funding coming from industry as they're trying to stay proactive and understand what's happening here, so we can try and stay ahead of things. The objectives for this study, looking at feedlot and the downstream environment, as well as the processing plant or the packing plant at retail, and trying to look at what samples from all of these different locations are telling us. Focus on E. coli and enterococcus, one because it's a pathogen, the other because it's a common carrier that could be involved in transmitting some of these genetic determinants. They're going to try and bring in the human clinical enterococcus isolate information, albeit we're not going to be involved directly in that. They're going to do the genetic characterizations of that. Number 5, determine the associations between AMU and resistance information from these bacteria, and really try and understand if there's something happening there, particularly in the second sub there, looking at enterococci selection, selected as an indicator of macrolide resistance. Obviously, over the last probably 10 years in the U.S. and 9 years in Canada, quite a bit wider use, or at least continued extensive use of the macrolides in feedlot production, and trying to understand what's happening there, and then trying to understand more about the genes and the mobile genetic elements using the metagenomic samples and the metagenomic analysis techniques, of which I'm not sure we really understand how valuable or non-valuable some of those tools are going to be. And again, we got 4 feedlots enrolled. These feedlots, two of them are feedlots that were in the 2007-2010 project, and 2 are different feedlots. And they were really selected because of their geographic location in this case, because we're trying to understand what's happening in the watersheds around them. So we were looking for feedlots that met the criteria for data collection and antimicrobial use data, as well as being physically located in the watersheds they were studying from the human side. And we're taking composite fecal samples, multiple pens in the feedlot, randomly sampled over time, and spacing that out so the lab can process the samples. We're doing samples from the catch basins. We're doing samples from streams leading or waterways leading to the feedlot, and those going exiting or coming out of those drainage areas. We're looking at both the metagenomic samples from the feces and the water to try and understand how these genes or evidence for some of these genes moving, even if we don't know what particular organism they're in. Obviously, you got the surface water, and then they're going to try and tie that to processing facilities sampled monthly. And then, obviously, we have all of the antimicrobial use data, both the individual animal stuff as well as the in-feed antimicrobial exposures at the pen and at the catch basin level within those feedlots. So we can try and understand what is the role of this antimicrobial use or what isn't it in terms of the resistance isolates and determinants that we detect in all these samples. So fairly ambitious project, lots of laboratory work, lots of analysis work to do, but trying to look at it, not just trying to do the same things we did before, but looking at something different. So in summary, understanding the impact of feedlot antimicrobial use on antimicrobial resistance of human or animal contests is extremely important to developing a sustainable plan that will allow us to use antimicrobials in feedlot production. It's a complex issue, as you guys all know, and it requires large-scale structured research approaches with a multidisciplinary team. I think we'd be folly to think that we can just submit a few samples here and there along the way and try and understand this. At least the data that we've seen in Western Canada so far suggests that the industry is on the right track for proactively developing a sustainable AMU plan for feedlots in Canada. I don't know how that extends to the U.S. or to other geographical areas or jurisdictions. Additional research, development, and innovation will be required over time to continually improve our abilities to manage this issue in a proactive and data-driven manner. And I guess as a private veterinary practice, our role has been to be actively involved in helping generate samples, data, funding, industry support to improve our collective knowledge, and that's really what the role we've tried to play as we tried to learn more about this issue.